Welcome, Dr. Patrick. So happy to meet you and have you on the podcast today.
I'm so happy to be here. Thanks for the opportunity. I appreciate it.
You're so welcome. So first, let's just go into what you're doing now, but really how you got to this place, because I think the path of how you got there will explain the choices that you made that are specific to what you do now.
Well, I'm a doctor of Naprapathic Medicine. Okay, and I'll explain what that is first, because a lot of people don't know what naprapaths are. But naprapaths actually started right alongside chiropractors back in the early 1900s. Dr. Oakley Smith, who founded Naprapathic Medicine, was a protege of D.D. Palmer, who founded chiropractic medicine. Okay, as a matter of fact, Oakley Smith was one of three authors of the manual Modernized Chiropractic that D.D. Palmer built the entire chiropractic profession on. Okay, so D.D. Palmer brought Oakley in to prove the subluxation theory in chiropractic medicine. Okay.
What is that
And
theory?
the subluxation theory is the alignment of the bony structure in the spine, right? And if that alignment comes out, then you're going to have interference in the nerve lymph blood flow, which is absolutely accurate. Okay. And that's what, Oakley Smith believed as well. But D.D. Palmer believed, and the whole chiropractic profession believed, that in order to get that vertebrae back into alignment, you needed to use a high velocity adjustment to do so. Okay. Well, Oakley Smith did not believe in that. Oakley Smith believed that you had to treat the connective tissue that was pulling the bony structure out of alignment in order to keep that bony structure in alignment and get that proper nerve, lymph, and blood flow. So that hoopla broke those two gentlemen apart. Okay. And obviously, D.D. Palmer was a much better marketer and got that profession out there. It's worldwide. Oakley Smith was a genius, but Oakley Smith, turns out, was socially inept, couldn't get along with a soul. So this man developed scientific manipulative therapy. He developed something called chartology and chartosis, which is the marking of the spinal column by taking tension findings, both tension findings and hyperesthesia or pain findings. And based on those findings and then charting those findings on a chartabar, he called it, you can then design a treatment and treat that individual to bring that bony structure back into alignment without a high velocity adjustment. So Oakley really did scientific manipulative therapy, but never really was able to get it out there like D.D. Palmer was. So, Oakley, got the school opened in Chicago. That school opened in 1906. I graduated from that school, the Chicago National College of Napropathy. It's the only school in Chicago and was the only school for years and years and years. And then I became a naprapath in 1983. All right. So I've been a naprapath for almost 40 years.
Now, how did
But
you, let me just interrupt. How did you decide, find out about it? You
all
were
right,
living in
that's where I was going
Chicago.
to go
Yeah.
right
Okay,
now.
good. Yeah.
Okay. Because my uncle was a naprapath.
Ah.
My uncle studied with Oakley Smith. So the only medicine I knew as a kid, if I didn't feel good, I went and got a treatment. If I didn't feel good, I wanted to go see my uncle and he'd give me herbs and he'd give me, foods to eat. So it was really my entire life. So I've been, following an anti-inflammatory, regenerative type lifestyle diet my entire life. I'm going to be 70 years old this year. I've never taken a prescription medication in my life. I don't plan on ever doing that. I believe that food is medicine, and that's what we preach. And my book, Anti-Inflammatory Medicine, talks about how napropathy and nutrition, anti-inflammatory medicine, really works to help us take care of ourselves. Because, many people, unfortunately, learned about health these last few years with this pandemic, and I think it was a real wake-up call to people that, what am I going to do? Are people really this sick? Am I really this sick? Do I really not have an immune system? What is an immune system? So people got aware. And I think the food is medicine movement is here to stay, and the regenerative farming and the restorative lands are really here to stay, and that's really what we work with in our school. Now, I got into napropathy, obviously graduated 40 years ago. And I had an extremely successful practice back in Chicago. And I practiced there for 20 years. And my practice really focused on neuromusculoskeletal pain, but my specialty or my area of treatment was survivors of adult survivors of childhood trauma, physical, emotional, sexual abuse, right? Because it impacted the body tremendously. So I really didn't do it on purpose, but I became specialized in that area, and I had many, many, many therapists referring to me, and built a really large practice. So back in the late 90s, I decided to open a retreat center in New Mexico. And we were bringing groups of patients from my practice in Illinois into the Gila National Forest in the southern part of New Mexico. And we were treating adult survivors of trauma. And we were, doing it nature, hot springs, horseback riding, treatments, that type of stuff. And I was traveling between my office in Chicago and my retreat center in New Mexico every other week. And this happened back, and I'm going to give you the story because this is how I am where I am right now. In '99, I opened the retreat center, and it was in the southern part of the state. And I would only bring a retreat out once a month, a week a month. But I would be there every other week. So the weeks I wasn't working with retreats, I was seeing patients. So this was the summer of '99. I got a phone call from this gentleman who got on the phone with me and said, "Hi, my name is Benny. I broke my neck in a car accident a couple of years ago. I've been everywhere. I heard you could help me. Could I come in for some treatments?" Right? So this beautiful old New Mexican man shows up in my office a couple of weeks later, and I started treating him. And, indeed, he was really locked up and frozen, and, a lot of pain, couldn't sleep. Started treating him. You see, napropaths treating the connective tissue. I'm not trying to adjust him back into alignment. I'm untying all the knots. The fascia should be right. Connective tissue is three things, right? Ligaments hold bone to bone, tendons hold muscle to bone, but the most prevalent connective tissue is called fascia, or interstitial tissue, right? So fascia in its natural state should be viscous and gooey. So when you're turning your head or you're moving your arm, the muscle should glide over that gooey fascia, right? As a yoga practitioner, I'm sure you're incredibly familiar with this. But when fascia dries out, right, it turns to glue. And when it turns to glue, it glues layer to layer of muscle together, and that's what those knots are. So when you're moving the bony structure, instead of those muscles gliding over that viscous gooey fascia, it acts like a fulcrum. And then it moves and pulls bony structure out of alignment. So you can't just go back on bony structure and try to realign it, because that fascia, which is glued to the muscles, which is glued to the tendon, which is glued to the ligaments, will continually pull it right back out of alignment.
That's
So
why
with
people that's
Benny,
why people are going to a chiropractor for 10 years.
well,
And they're not changing necessarily because they're not addressing that
they're not addressing
what's pulling it out of place in the first place. Yeah.
exactly. And they're going to chiropractors for 10 years. But I also hear, I ask patients all day long, right? Have you ever seen a chiropractor? And about 80% of them will tell me yes once, because they don't like the cracking sound. And even, it's hard. So we provide a viable option, an alternative to the chiropractic treatment. And actually, it is chiropractic treatment because Oakley Smith developed it as chiropractic treatment more than 120 years ago, right? So they just went away from the soft tissue application of chiropractic. It's in that book, Modernized Chiropractic. Every chiropractor who's read the book has read it, but they focus on a 4 to 6 minute treatment. We adjust you and we get you out, and we'll continue to do that, And I believe in body work. I believe in all body work. It's important. But you've got to be specific, you've got to be able to take care of what's pulling that bony structure out without just a shotgun type approach, So that's kind of, what had happened there. So getting back to Benny, right? Benny came in, started getting treatments from me. All right. 2 months go by, 3 months go by. This was about we started in about, I think it was, June of 1990, 99, June of 99. I'm trying to think. That was June of 99. Well, by about October of 99, Benny walks into my office. He looks me in the eye and he says, Doc, he said, I'm sleeping through the night. I'm taking about a third of the medication I was taking. I feel like I got my life back. We need to get you licensed here in New Mexico. And I thought, the hell's Benny talking about, right? Well, Benny turned out to be Senator Ben Altamirano, okay? And he was the president pro tem of the New Mexico Senate for 34 years. We introduced the Naprapathic Practice Act in Santa Fe in the year 2000. It took me 4 years to get the bill passed. I had no idea what I was doing, but I did it. I went after it, got the bill passed, signed into law. When the governor signed it into law in 2004, Governor Richardson, I was at the signing ceremony, and Richardson and Benny both looked at me and said, Doc, you got to bring a school here to Santa Fe. And I thought, okay, I'll do that. I had no idea what I was getting myself into.
Can you just
So,
pause and explain to everybody the importance of getting that in legislation? What does that translate into meaning?
well, what happens is you've got to, in order to practice a healthcare profession in a state, you've got to be regulated.
Right.
Okay. The state has got to regulate you. So what we introduced was a Naprapathic Practice Act in the state of New Mexico, making it legal for naprapaths to be licensed and regulated in the state of New Mexico. And we got that done. We introduced the profession. We got it done. We got it through. As a matter of fact, the New Mexico Medical Board is the board that oversees naprapaths in New Mexico. And we're classified and licensed as connective tissue specialists. Okay.
That's fabulous. Wow.
Yeah, so we got a wonderful license, a wonderful practice act here. The state is amazingly supportive of us. Every major insurance company in New Mexico covers naprapathic treatments, okay? The state of New Mexico and the governor actually has waived all deductibles for people who have musculoskeletal pain so they don't wind up in the emergency rooms, okay, and costing them tough, so they can see us directly. And also, people have to realize the number 2 and 3 reason people go and see medical doctors, you know what that is? It's joint pain and back pain, okay? And for people with joint pain and back pain to wind up in a medical doctor's office is totally makes no sense, okay? We have a huge opioid problem in this country. And guess where they all get the opioids, okay? Because they don't know what to do, right? So, joint pain, back pain is something that manual therapists need to treat, like chiropractors, like acupuncturists, like naprapaths, like physical therapists. It's just got to be more accepted. And it's got to be more scientifically based. And I'm going to read something that Oakley wrote in a second about that. But anyhow, we got the Naprapathic Practice Act passed in 2004. I got a license for the school to operate the school in 2006. It took me 4 years to put a curriculum together and figure out what the hell I was going to do to open a school, right? We opened the school in 2010. We graduated our first class in 2014. I'm giving you this order because this is how things moved. In 2015, I petitioned for accreditation for the school, the first ever, because this profession is 120 years old. Nobody ever accredited a school. That's why this profession hasn't grown, right? One of the main reasons this profession hasn't grown, except, besides Oakley Smith being a medical heretic, let's call it that. So we got the license for the school, went 2015, petition for accreditation. 2016, our petition was accredited. It took us 5 years to get the school accredited. And in the end of 2021, the Distance Education Accrediting Commission, which is a recognized accreditor by the U.S. Department of Education, accredited Southwest University Napropathic Medicine as the first and only napropathic school. We run in our campus here in Santa Fe, New Mexico. And I'm happy to say, I just got this news on Saturday, that in January of this year, 2023, the Naprapathic Practice Act of Nevada was introduced. And we lobbied the Nevada legislature for the last 4 months. And Governor Joseph Lombardo signed the Naprapathic Practice Act into law just this last Saturday, June 9th. And naprapaths will now be able to practice and bring a school to the state of Nevada. And, our plan is to move this profession forward, okay? And one of the ways we're doing that is our program is about 75% online, okay? Now you have to have we offer the program two different ways, okay? We offer it to people who have a bachelor's degree, okay? They have a full bachelor's degree, and then they come into our program an extra 180 quarter credit hours beyond a bachelor's is our degree. And we do that in 3 years. 75% online, the rest of it is in the clinic and in the intern clinic. So the first 2 years of our program, you're taking all your online classes, all your basic sciences, your napropathic sciences, and then 1 day a week, you're in the school doing either 1, 2, or 3 hands-on classes, depending upon your quarter you're in, okay? Those first 2 years, you get through all the hands-on portion, and then you'll have to sit for a clinic entrance exam to enter the intern clinic, which is the 3rd year of our program, where a student will enter the clinic, finish up their classes. And by the way, I didn't mention this, but we're very, very, very steeped into research. Oakley Smith has done incredible research on the spine and the spinal column, and has done the Chartabar and Chartosis. And we are now, as an institution, providing the proof of manual therapy. And I want to read this right now, because this is basically why we're doing research. And Oakley Smith wrote this in his book, 1917 book called Chartology Chartosis. And this is the manual therapy of the spine. But he wrote in this book, Napropathy represents the world's first introduction to charted manipulative methods. Naprapaths, by charting their diagnosis and manipulation, place themselves in a class alone. The first attempt in the field of napropathy to chart all manipulative procedure represents not only one of the beginning points of the science of napropathy, but represents the very beginning point of scientific manipulative therapy. Scientists have always been prone to cast to one side any modality that was not closely interlinked with evidence of scientific detail. Possibly it is for this reason that manipulation as a means of cure was passed over by science. If such reason is correct, the introduction of napropathic chartology, with all its wealth of scientific possibilities, will furnish every person of science full expression for their greatest talents. So we are devoted at proving the science of manual therapy. And what we're doing right now is, Oakley Smith disproved the subluxation theory. And Oakley Smith wrote about the ligatite and how the ligatite pulls the bony structure out of alignment, right? So the ligatite is really what we're trying to prove as what pulls bony structure out. So what we've done as a school, as we've purchased some ultrasound equipment, and we are now ultrasounding the ligatites.
What are the ligatites?
The ligatites are the lockdown of the ligaments on the spinal column that pull bony structure out of alignment, right? Oakley Smith has defined a ligatite. He's defined a ligatite, as that tightening of the ligaments, okay, that then pull bony structure out. You could imagine if you tighten a wash rag, okay, that's how ligaments start to spiral. Even fascia spirals, okay, tendons spiral, muscles spiral under tension. And when they spiral, they shorten. And when they shorten, they're going to pull bony structure out of alignment, right?
Is this like the anterior longitudinal or posterior longitudinal ligament, or are these smaller ligaments between
these
individual?
Are 17 ligaments that hold the one above and the one below.
Right.
So the anterior, all the ligaments, we're going to go into an area, okay? And we are able to mark it on the ultrasound. We can specify an area and go into a ligament and find if there's a ligatite there, and if there is a ligatite there, treat that ligatite and then bring circulation to it and show inflammation decrease and ligatite tension decrease by the treatment itself. So that's how we're going to prove manual therapy out there and the results of manual therapy that's not just anecdotal.
Yeah, well, so for people that are listening and they're like, this sounds interesting, but they're probably like, well, how do I avoid how do I avoid that happening? Like, what are the things that are contributing to this lockdown of the tissues, whether it's the fascia or the ligaments themselves? What would you say are the biggest contributors?
Well, one of the sleeping positions, sitting positions, repetitive motion is the main thing, right? Repetitive motion will, knock something out of alignment more than anything else. So you've got to work against those repetitive motion conditions. And, stretching, I mean, I always get people towards yoga, towards Pilates, you have to be in a stretching regimen every day. I get people to stretch over, exercise balls, right? And I never have people, and this is something I have them stretch over exercise balls, the spine, right? Because the spine, I'm looking at the spine behind you there, okay? Those facet joints in that spinal column are all movable joints, okay? Yeah. Never, never, never use a lacrosse ball or a foam roller to try and stretch out the spine, because you crush those ligaments. You actually irritate those ligaments. You've got to make the facet joints move the way they should move in order for those, circulation to get in there. Just to put it on a hard surface, and it makes me cringe when people tell me that they laid backwards on a foam roller to adjust their back. You're going to do a lot of more inflammation in those tissues, because if those tissues are
facet joints are in the spine the only synovial joints. The
Exactly.
rest of the joints are cartilaginous, and that just kind of tells us structurally, like, cartilaginous is there for cushioning and shock absorption and energy flow. Synovial joints are there for movement. So when we're trying to also like twist the cartilaginous joints or like manipulate them, that's not what we want either. It's that you want to encourage the tissues around it to like loosen their grab. Yeah.
There you go.
Yeah. Yeah. So yes. So I mean, I'm a physical therapist, but my specialization is neuromuscular, and I do a lot of, and fascial trained. So yes, I am grooving with everything you're saying. Now, what what it sounds like is that to treat someone, you have to have them in person, or is that wrong? Is there anything yeah. Okay. It's hands-on. In addition to that, like, what are some of the other things? Because I know one thing that I was learning about, because I had not heard, and maybe you can clarify this for people that are listening. You talked to us about what napropathy is, but when people say, well, naprapath, napropath, like, what are the differences between those two? Because that's an easy confusion. Yep. But do you have, is that another layer of what you offer? Because I'm assuming like you mentioned the anti-inflammatory diet. So it's like what you put in is going to be a wonderful adjunct and ally to whatever manual work you're doing. Right. Mm-hmm. Got it. Right. Yeah. And I think it's really important for you perhaps to explain, because when people hear manipulation, that has a negative connotation for some people, for many people. And, as a PT, I also am trained in manipulation. There are different levels. So manipulation does not mean it's forceful. I think that's what you're talking about, the high velocity. So what is that What does that look like? I mean, I'm sure it's just you're just basically, I'm imagining in this manipulation, what you're really trying to do is have a conversation with the nervous system in some way and some pressure to subject to the fascia so that it's not that like stuckness, but it's getting a little more viscous. Is that correct? Mm-hmm. Mm-hmm. Yes. And that's been shown. Yes. Yes. Mm-hmm. All right, so somebody comes in and they have their primary complaint is anterior hip pain. Where do you find that is, whether it's originated or related? Where do you find that you go to help with? I mean, I know that's a kind of a general thing, but mm-hmm. Mm-hmm. Huh. Mm. Now, speaking of those, because I think they're highly linked to our sympathetic nervous response as well, the paraspinal. So going back to how you um, indirectly started working with these people who had early childhood trauma, did you find that there was just a lot of um, inability to turn off that sympathetic response all the time? And is it that you went through the body to help calm some of those the communication of, like, again, the nerve bundling? Mm. Mm-hmm. Yeah. I I love, yeah. Oh, Patrick, I really appreciate you said that. And I think that's just such an example of how the body is always holding memories maybe we're not aware of. Like you said, and there was it did what it had to do to survive that. But it is always important to be able to be with people who are, um, you know how to manage that and are, oh, mm-hmm, many. Absolutely. Well, thank you so much. We could just talk forever. I love that you're educating me about this, and I feel like I know a lot about different modalities. And I've heard of napropathic. Am I saying that right? Yeah. But you really defined it in a way that I understand fully now, and I feel like that you're a pioneer. Like you took these different legacies and brought it forth so that more people can have access to it, because making it accredited, making it available for people through healthcare insurance is crucial to being able to get it out there, because so many people would not otherwise necessarily be exposed to it or could afford it. That's amazing. It's all the different professionals, healthcare professionals out there. Check this out. Well, and tell us just for a moment about your book. What is it about? What does it entail? Who would want to read this? Oh yeah, yeah, uh-huh. We absolutely do. We could talk about that so much. I mean, we need to change um, our just addiction to easy and fast and packaged and the meat consumption, et cetera. It's all too much, and it's really destructive, and it's not good for us either. Whatever's not good for the planet pretty much is also not good for us. So we should, you know what I mean? Like it's an ecosystem, and this is our mother, our sister, our brother. Like we should take care of her in the way that we would take care of ourselves. And so I love that you wrote about that. So where can people? Yeah, go ahead. Yeah, I love that. Well, you're a great example. Almost 70 years old. You're just full of life and zest. I can see it. And Thank you so much for sharing your time and energy and your expertise. And it was just awesome to meet you. I hope to make it to New Mexico someday. Yeah, I'll do that once we sign off. That sounds great. All right. Thank you so much. And for everybody listening, as always, I'm pulling for you.